Hello, my name is Dr. Mary Hancock, Professor of Nursing at Shepherd University, located in Shepherdstown, West Virginia. I was the Principal Investigator for the Future of Nursing West Virginia Action Coalition's Bedside Registered Nurse Retention Study. I am honored to present the study's results with you today. Registered nursing is one of the fastest growing occupations in the United States. The number of RNs needed to meet the healthcare demands of Americans is roughly over 200,000 each year through the year 2026. A 2007 study discovered 13% of new graduate nurses changed their primary job within 1 year, and 37% stated they were considering a job change. Roughly 40% of new graduate nurses wish to leave nursing within 1 year, highlighting the need for retention efforts in healthcare organizations. Recruitment and retention efforts focus primarily on the new graduate RN, not experienced RNs. The purpose of this descriptive qualitative study was to identify factors to retain experienced bedside nurses in the state of West Virginia. Because of the rural nature of the state and the current COVID-19 pandemic, the study was conducted via email using a semi-structured interview guide. The inclusion criteria for the study were entry-level registered nurse licensed in the state of West Virginia, currently employed in a healthcare organization within the state, and 5 or more years of experience at the bedside on the same nursing unit in the state of West Virginia. All 22 participants identified themselves as white, non-Hispanic females. Ages were varied, with the majority within the 31 to 40 age group. Additionally, BSN prepared non-certified medical surgical nurses with 5 to 10 years of experience represented the majority of the participants in this study. The themes and subthemes discovered are listed with subthemes in bold font highlighting participants' responses in their own voice. The theme of compensation discussed the wage gap between the new graduate RN and the experienced RN. West Virginia RNs strongly feel they should be paid for their experience and expertise. The study participants indicated healthcare organizations spend a great deal of time, effort, and money recruiting nurses, but the same is not said for retention. The theme of leadership has resonated throughout this study. Negativity, lack of understanding of the bedside RN role, lack of support, and inability to accept ideas for change from bedside RNs were the main responses. Discussions of leadership also generated positive responses, such as she goes out of her way to accommodate scheduling requests. She also stands up for us during hospital-wide issues, as noted by participant 12. The nurses discussed nurse-patient ratios are needed to ensure patient safety by using a patient care staffing model. Discussions also included healthcare organizations adequately staffing units, less pulling to other units, and not scheduling procedures when staffing is inadequate. Nurses in West Virginia remain at the bedside because of job satisfaction. This theme yielded 3 subthemes of patient, co-worker, and work-life balance. Longevity on a hospital unit encourages trust among RNs, staff, and efficient team functioning. This was a positive factor in nurse retention. Work-life balance was also a factor in remaining on a nursing unit. The experienced RNs are concerned about the future of nursing. Standardized preceptor and unit orientation were discussed. Many RNs expressed concern regarding the lack of skills the new graduate RN presents with. However, what skills are lacking were not defined or discussed. Pre-licensure nursing curriculum was also discussed by a few participants. The theme of retention generated the subthemes of recognition, growth opportunities, and ideas for retention. West Virginia RNs would like to be recognized by healthcare organizations. West Virginia RNs leave their nursing unit for other opportunities if those opportunities are available. Suggestions for improvement included the development of a clinical ladder to provide advancement of bedside RNs, ensuring breaks, and the implementation of a nurse-patient ratio model. In conclusion, West Virginia RNs stated they should be compensated for their experience and expertise. A balanced effort in recruitment and retention is needed. Nurse-patient ratios, adequate staffing, improved compensation for experienced RNs, enhanced communication with leadership, and attention to work-life balance of employees were cited as needs. Leaders need to acknowledge the expertise and experience RNs bring to the healthcare organization. Please scan the QR code for a list of references. Thank you to the Future of Nursing West Virginia Action Coalition's Director, Ayla Akade, for the opportunity to complete this important research study, and the West Virginia RNs who took the time to participate in the study during the pandemic. Questions regarding this study can be emailed to me at mhancock@shepherd.edu, and thank you for your time.